Hey everybody, welcome back to Dental Unfiltered. I'm Matt Brown. I'm here with normal co-host Dr. Andrew Vallo. Guys, we're in a super exciting time in dentistry. We can scan someone's mouth, show them what the inside of their mouth looks like in 3D on a screen in front of them. We can print appliances. Artificial intelligence is getting involved in our industry in so many places, from treatment planning to design work to Invisalign to answering questions for patients via text message and other mediums. I mean, AI is kind of hitting everything now, and it's starting to hit dentistry. And Dr. Vallo recently purchased Overjet for his practices, and Overjet's a product I've been tracking for a while now, and I've seen demos of it, and it's pretty remarkable stuff. And we want to have kind of an episode about him shopping for it, him getting it, him implementing it, and kind of where he sees the benefits in dentistry. So, Andrew, I know you just got Overjet for your practices.
Yep.
What was it that made you decide to take a serious look at it? Because it seems like in dentistry, a lot of the new toys come out and the new technology, and they're exciting, and people are always interested in looking at it and learning about it. But there's a difference between looking at it and learning about it and saying this is pretty cool versus I need to get this for my entire group. So
Yeah.
what was it that made you decide to take this very seriously?
Yeah. So, I think when it comes to new technology, I wouldn't consider myself an early adapter. I'm not the first one in line to get the newest scanner or cell phone or, computer. I like whenever new technology comes out, I like to let the early adapters get it. And I like to see how it works first from the sidelines and make sure one, that it actually does what they're saying it does, that people are happy with it, and two, that it actually is bringing an impact to practices and it's having an ROI. Because, guys, today in dentistry, you know it. If you ever go to any of these big conferences, I mean, there's a million booths. There is like constantly just so much new technology out there. So, and my mindset is, you don't want to waste a bunch of money investing in brand new technology before you know how effective it's going to be. So again, I'm not an early adapter, but I also don't like to be too late to the party either. So, I think at the same time, there's dentists that resist change. There's dentists out there. We were just talking to someone on Matt's team the other day about how they got an amalgam filling, and we're not going to get into amalgam versus composite, but my point is, I think that there's still dentists that are doing things in antiquated ways, using antiquated technology because they are resistant to change. So I don't think you really truly want to be on either end of the spectrum. I don't think you want to be the first in line. Let the other people be the guinea pigs for you. I don't think you want to be last in line. You don't want to be last to the party, because then everything's going to pass you up and you're missing out on things that can make your practice more efficient, things that could help you diagnose and produce more dentistry, things that can, make your patients happier and more impressed, and things that can make it easier and a better experience for your patients. So I think you have to constantly be in tune to what's going on and what new developments there are out there. And I think you should do your research. And as soon as you know that it's a good product and it's going to bring, it's going to bring you a positive ROI, I think that's the time to invest. And so that's kind of where I've always been, and I think that's where I've been with this AI software like Overjet and Pearl. I've had my eye on that software for the last couple of years now. I almost pulled the trigger last year. Main reason, honestly, I didn't. It was because it wasn't compatible with our imaging software at the time. But again, I wanted to talk to some more docs. I wanted to kind of see it in action at some other practices some more before I decided to. And so in my mind, as we were preparing to open a couple new startups here, I figured this was the perfect time. And actually, I was going to roll it out in the new offices first, see how I liked it, and then bring it to the other practices. And I spoke with some of my team, and the team, some of my team members at my current offices had used it at other places. They really liked it. They wanted it there. And I said, hey guys, as long as you're going to make good use of it, I'm happy to implement it here, first. So we actually, I believe we just had it installed this week. I don't know that it's fully functional yet, but I'm very excited for us to start utilizing it in our West Chase and Riverview boutique practices. And then as soon as the new offices are ready to open here in about a month or so, we'll be rolling it out there as well.
So you got Overjet, and it's obviously a new technology. It was kind of a couple years ago is when it came out. Now it's kind of becoming more commonplace.
Yeah.
I mean, it's obviously a large investment, right? So I know why you did it. What kept you from doing it the first time around? Like, what was your why did you hold off really? Like, what was your whole thinking process?
Yeah, I mean, like I just kind of said there in the intro, Matt. I just again, I don't like to jump into new technology too quickly.
You're
So
just
I think
worried
that
about about it being functional.
well, yeah, you worry about how accurate is it, how many bugs are there, and like, is it actually going to be worth the investment of? Because like, it's not just the monetary investment. Because yes, it does cost money to get these programs installed, and you
It's
pay
a human
monthly
though.
and whatever. But there's also the time investment. I mean, anytime you're dumping a new software system, technology, equipment, whatever on your team, I mean, there is that learning curve, that time where they have to get the learn using it. So like, I don't want to invest in something and then us realize it's not actually a good fit for the practice and have just wasted all that time. So I like to be fairly certain before we do. But again, the other thing was that as these like softwares come on the market, they're only compatible with certain imaging softwares, and so the imaging software we had was not compatible with Overjet or Pearl last year when I had checked. So in my mind, I was like, you know what, I'm gonna give it some more time. I'm gonna do some more research on it, and maybe they'll become compatible with my imaging software in the meantime, and then if not, eventually we'll switch. And we decided to switch to Overjet's imaging software, so it's like as compatible as possible. And they gave us a nice deal to switch the offices and switch their software and everything. So
That's awesome. So how long? I mean, are you still in the middle of the implementation process? How long is the implementation process, and how painful has it been?
yeah, I mean, again, pretty early on, and I will say with me being kind of removed from the offices a little more the day to day, I mean honestly, they could be using it today for all I know. I'm not entirely sure, but
Okay.
I'll get reports back. We'll as we have our weekly leadership meetings, we'll kind of find out where things are at with it. But if it's not up and running yet, I would imagine by next week it will be. And we can always do another episode later as I talk about I mean, today I think the goal of this episode is to talk about why I think it is impactful now, the things that we hope to use it for. And then, we could do a follow up episode and we could talk about if it truly did meet my expectations and all that. So that could be fun.
Where did you see the ROI in it? And are your dentists seeing the ROI? Do they believe in the ROI? Because sometimes we as leaders like, hey, we're going to do this, and the team's like, I don't really see it. Did everyone see it uniform? What you saw, or like, what was that like?
So I think the first thing is we're all human, and so we all miss things. And I mean, it's as not that it's ever intentional, but I mean, when you're seeing a bunch of patients and you're looking through X-rays, you can miss a cavity. I mean, are you going to miss a giant cavity? Probably not. But could you miss a small cavity? Yeah. Same thing with diagnosing perio. I mean, as we're doing, and this is a whole nother conversation, but frankly, I think probe depth measurements determining whether or not a patient has an active, bacterial infection in their gums is not the best way to kind of make that decision. So, and that's a whole nother topic, and maybe we can get into that in another episode. But in my mind, and we've talked about this during the chief hygiene officer episode, I think we're missing periodiagnosis. And this AI software, I mean, it literally shows you where bone loss is at, in the different pockets. So I think it's going to help us make sure we're not missing both restorative and periodiagnosis. I also think it's going to give our hygienists and our docs more confidence. When you see something and you're kind of on the fence, like is this truly there? Is this truly a problem right now? And then you've kind of got something backing up. So this isn't to treatment plan for doctors and hygienists. It's kind of more as a backup. It's to help. It's one as a safety net to help make sure we don't miss anything. But more so it's to kind of reaffirm what we're seeing in the x-rays, what we're seeing clinically. Yes, this is truly there. This AI software is seeing the same thing that we're seeing. So it should give our docs and our hygienists more confidence as they present areas of concern to patients, because they saw it and now the software is kind of backing them up on it. So
It's really just a second look. It's a second set of eyes. Because like I've
yeah.
had, so some docs that haven't looked at it that I've talked to, I mentioned Overjet and all the AI innovation in our industry, and I've had older docs be like, I don't want a computer treatment planning my patients. It's not really a treatment plan. It's a second
No,
set of
no.
eyes.
Yes. No, you're not having, and you shouldn't be having AI software create treatment plans for your patients. That's in my mind, that's not how this should be utilized. It should be exactly what Matt said. It should be another set of eyes to help make sure you're not missing anything. And then, if the computer's telling you that there's a cavity there, maybe you take a second look and then you're like, oh, you know what? I did glance right over that. Yes, absolutely. I'm seeing that cavity on that x-ray now. So I think it kind of helps you take a second look at areas that you may have passed over. And then again, it reaffirms the things that you are seeing. So you're still making the diagnosis, you're still making the treatment plan, you're just using that to kind of help back everything up for you. So I think that's where the value lies. But
It's kind of the equivalent of like a virtual dental assistant saying, "Hey doc, go look at this."
like with co-diagnosis, absolutely.
That's what it really is. It's like, here are the X-rays. Hey doc, I saw this. Did you see it? Or it's really like, hey doc, here's the whole X-ray, and here's all the red flags I saw. The
Well, and
ones
we're,
that you
we're
see
going
that
to
I don't
use it
see.
for calibration too. So it's going to be a great tool to help our doctors and hygienists and assistants get calibrated with what we're seeing there. The other reason that I think it's going to be super impactful is from the patient perspective. I think especially for new patients, I think it helps give them confidence and build trust when the hygienist, the doctor, and now this, AI computer software are all seeing the same thing. So, it's again kind of backing up the diagnosis that the doctor's making, backing up things that the hygienist was already talking to them about. And they can see it right there on the screen. Like it lights up these cavities like a Christmas tree. So there's no second guess. And think about it this way, docs listening, how often are you're talking to a patient about treatment needs, maybe you're talking about interproximal decay between 4 and 5, and patients like, can you show me the cavity? Now again, I'm usually showing the patient the x-rays and going through them, without them asking, but some people may not do that. Let's say it's a smaller cavity, but it's definitely there, you absolutely feel like it needs treated at this point, it's getting through the dent and it's getting close to the enamel, and you pull the x-ray up on the TV and you're messing with the contrast a little bit so they can really see it. And you got to think about it, like 99% of your patients aren't trained to read x-rays, unless they're in dental or they're in medical somewhere. They're not trained to read x-rays. This is not something they're used to looking at. It's a smaller cavity. Depending on the quality of the sensor and depending on the quality of the actual x-ray that was taken and the quality of the TV that it's now blown up on, there's times where like I look at it on the computer and I'm like, up cavity, and then I go pull it over the TV and I'm showing the patient, I'm thinking in my head like, I bet that they don't really see that. So I think there are times where the patient has some doubts and they want to see it for themselves to truly believe it, and they can't really see it on the x-ray because they're not trained, and it just doesn't look that clear up on the TV. But with this software and the software blowing it up and turning it colors and showing it to them, I think it makes it that much more apparent. I think it builds more trust with the patient, and I think it's going to help patients, especially patients who are newer to your practice, move forward with more treatment.
In reality, everyone was arguing. I have docs that come to me and they go, "Can you find me some patients with a little bit higher dental IQ?" The reality is, patients that have work in their mouths, where this is really important, have very low dental IQ, and any aid to help educate them better about what the reality of their mouth is beneficial, right? And it's like this kind of highlights all those things. Hey, these are all the things that the AI found. And I think if I was talking to a patient, I would explain that it is AI, because AI is used in so much today in people's consumers' lives. People have developed already like a thing where it's like AI is better. Like that's already a perceived consumer behavior. So I would even say that it was AI because like AI found it. It's got to be right, right? So one question I had was, how was Overjet as a company to work with? Was the support good? Was it a smooth? How were they as a cultural? How were they to work with?
The advantage of having a robust leadership team is that I often don't have to have direct interactions with companies. So I did have an interaction with Overjet a year ago when I first was demoing
Okay.
their software. And at that point, it was good. It was a good demo. But this time around, it was actually our CFO. He headed this project. So, I told him, hey, I want to look into these AI softwares. There's Pearl, there's Overjet. Can you reach out to these two companies? Like, here's a list of questions I want you to talk to them about. Do some demos, get some pricing. See if you can get any discounts for our group. Come back and kind of give me a report. And so he basically did. He gave me a report on the two, pricing for the two, his recommendation between the two, and that's kind of how we went with Overjet over Pearl. So I actually had no interaction with either of the companies for this time around. I delegated and trusted, although I mean it's my father, so obviously there's some trust there, but I delegated and trusted this project to a member of my leadership team. And as far as I'm aware, it's been super smooth sailing so far. So again, super early on. I don't even know if it's fully up and running yet. We will do a follow-up episode maybe in a few months to tell you how it's been
Can
going
we
for the
bring one of your
offices.
docs on to talk about how they like using it?
Yeah, we could probably get a doc on that. That could be fun. Now, I will tell you, we're only doing this in the general practices. So, and actually, this was a question asked by one of the OMs for one of our implant offices. Was like, "Hey, are we bringing this to the implant offices too?" And I said, honestly, guys, at this point, I don't really see the value for the implant offices. So, if you think about it, guys, people are coming in. They are coming in for a reason. They need teeth. Either they need their teeth removed and they need new teeth, or they have no teeth and they need teeth. They know what they want. They know what they need. We're not really diagnosing almost anything. Like, yes, there's a CBCT, and yes, our docs are reading the bone. But I don't know that there is enough value from this AI software for the implant side where we're going to find things that we weren't finding otherwise. And I told them, I said, hey, if we find differently, so like at our general offices, we're now doing implants. So, as we roll this out in general offices, if we are realizing that there's something I'm not thinking about and it truly is providing enough value, I will gladly roll it out at the implant offices as well. But right now, in my mind, this is more suited to general restorative hygiene, perio, that type of a thing, than it is for like an implant only office. So,
I'm a doc and I'm listening, and I contact you, and I've been exploring or thinking about exploring this, right? Is there any advice you give to that doc about how they think about and how they approach this, and when they should or shouldn't make this investment? Like, what would you, if a doc called you and said, "Hey, man, I think about doing this for my practice. I'm a single doc practice. I'm doing GP and some implants, doing 100K a month. I'm looking at this Overjet thing. What do you think?"
I think at this point in time, and again, early on, so I can't confirm the value that I'm expecting to see, but I do believe at this point in time, any GP practice would benefit from this AI software. I just I think any practice that implements this software is going to see, as long as you use it. I mean, you've got to get trained on it, you've got to actually utilize it, but as long as you use it, I think you're going to see more things that you're not seeing. I think you and your hygienist are going to be more confident in pointing things out to patients. And I think patients are going to be more confident in moving forward with treatment. So I don't think there's like a size of office or anything like that. I think if you're a GP office, you're doing hygiene and general dentistry, I believe you're going to benefit from this AI software. And again, I sat on the sidelines long enough, talked to enough other dentists that I felt confident to bring it into all of my general practices at one time here. Um, Now, guys, again, think about it this way: like, you bring your car in these days. Let's say there's something wrong with your car, a check engine light comes on. I mean, it's literally a computer that's reading an error code telling them what's wrong with your car.
Yeah,
Now, seriously, it is. I mean, it's
yeah.
almost the same thing, and they're relying on that. Now, could the mechanic, without checking the error code, could they inspect everything and figure out what's going on? Yeah, probably. I mean, that's how they used to have to do it. And just because an error code says something's wrong, are they just going to take that 100%? Or are they going to actually look at it? I mean, again, hopefully for them, it's just a tool to point them in the right direction and to give you confidence. It's like, hey, this error code means that this sensor is went bad in your car, or the fuel injector, whatever. And again, guys, like driving cars, don't know a whole lot about them besides all the problems I've had with my Corvette. But um,
That's a sore subject.
sore subject,
You
yeah.
were so excited to get that car, and you're not. I remember you getting it.
But I mean, that's my point. As a customer who doesn't have a high car IQ, I bring my car in. I've got a light on. So the check engine light's the first thing of AI. It's a computer sensor saying, "Hey, we've got a problem." And then the mechanic, the dealership, whatever, they then read the error code and they tell you, "Hey, this error code means there's a problem with this." And at that point in time, you pretty much believe them. I mean, you trust them. But like, let's say there wasn't. Let's get rid of the check engine light. Let's say you just brought your car in, for an oil change. There's no check engine light, and the mechanic goes and checks something and comes back to you and says, "Hey, we've got a problem with your fuel injector." And you're thinking like, I don't think I
Nah.
really noticed a problem. Are you sure there's a problem? So again, think about it the same exact way. You got a patient come in for a hygiene appointment. They don't feel anything wrong with their mouth. When you ask them, "Hey, is there anything new with your teeth? Anything that you're noticing? Anything you have questions about? Anything that's bothering you right now?" You're asking these questions. No, 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 doc. Everything feels the same as always. I don't notice anything different, anything wrong, no pain, no sensitivity. I'm great. Okay, good. And you're looking around, you don't have the AI software, and you're like, ooh, like there's a crack or there's a cavity or whatever it is, and you're telling the patient about it. And they're like, "Are you sure? Like, I just told you everything's fine." You're like, "Yeah, no, but there is. I'm seeing it here." And then again, maybe you're trying to show them the X-ray, and like maybe the mechanic is trying to show you something under your hood, and he's like, "You see that right there? Like, that's not supposed to look like that." And you're thinking like, okay, well, I have no idea what it's supposed to look like. So, it like he could be right, he could be wrong. I'm not sure. And that's like you trying to show him the X-ray. Like, do you see this? Do you see how it's like a little shadowy right there? Like, that's not supposed to look like that. And you're like, okay, like, are they telling the truth, or is there really something there? I don't really see it. Now, again, that analogy, you got the AI software. The AI software is literally like telling you, look at this right here. Look where there's less density, blowing up, showing you the color. There's a cavity. You see that giant red thing, the computer found a cavity. That was the same cavity that I spotted when I first looked at your x-rays, blah, blah, blah. All of a sudden, I think you build a lot more confidence. And again, same thing with the check engine light, the code with the car. If I have the check engine light on, I'm assuming there's something wrong with my car. And then, again, the mechanic telling me the code that it means. So I understand I kind of drew this analogy out a little bit, guys, but I do think it's relevant. I do feel like, because I always try to put myself in my patient's shoes. And I know when I go somewhere where I don't understand a lot about the process and I've got to trust somebody, I mean, there is so much trust you can build just, by being personable and building a relationship and talking to the patient. But I do think that only goes so far. And I do think having something else to back up the findings just does give you a lot more confidence that this truly is an issue. It does need a resolution. And I'm way more likely to on the spot get it fixed than if someone just tells me something and there's nothing to back it up.
We're gonna wrap this up, but just to support what you said about the patient, right? So I work in dentistry, and I haven't had a cavity in my life until I was like 40, 41 years old, and it was my local dentist here, and he told me after my cleaning hygiene check, you have a cavity. And then like he walked by the door of the operatory, there was a mirror on the wall, and I had my mouth open looking. He's, "What are you looking at?" And I was like, "I'm looking for the cavity." He goes, "You're not gonna see it." And he laughed and walked away and shook his head. And I was like, "You sure there's a cavity?" Never had a cavity in my life. Like that's the way we think if we don't have a real
Yep.
indicator to confirm visually. Like I was an idiot. I work in dentistry, I had my mouth open, looking in a mirror, looking back, trying to find the cavity. He laughed and shook his head and walked away. Like that's real. It definitely aids.
I'm sure all of you at one point in time have had a patient ask to look at their x-rays. You tell
Oh,
them that
100%.
they have a cavity or they need a crown or whatever it is, and they're like, "Can I see my x-rays?" And like they're trying to figure out, what, and they don't even know what tooth they're looking at. They're looking at the right side, thinking it's left. So I mean, like people do want to. A lot of people want to see. Seeing is believing, and so again, I just think the more evidence that we can give them, the more user friendly it is, the simpler it is, the more vibrant it shows up, all of that stuff. I think it does. I think it just brings a lot more confidence to the table. So anyways, guys, I'm excited for this AI journey. I'm excited to bring additional technology into my practice. We're in mid-November of 2024 right now. So probably sometime early to mid 2025, we'll try to do a follow-up episode, and I'll report back to you on how I actually feel like the Overjet software has been doing for our practice. And to Matt's point, maybe we'll get a dentist or a hygienist from the office to join the podcast, and they can kind of talk about how they feel about it, and how they feel like it's been beneficial or not. I mean, again, just like we always tell you guys, there's no product placement here. You know, the
Nope.
reason I'm talking about Overjet is because it's something new that I'm doing for my offices, and I'm excited about it, and I do feel like it's going to bring value. Overjet does not even know we're doing this podcast. They're not. I wish they were paying us. You know, no, we don't take any sponsors. We don't take any money from anybody. And so if I find that my experience is not what I hope it's going to be, I will gladly share that with you guys as well. So we'll give you a very unfiltered, unbiased follow-up episode about instituting that in the practices.
Hey guys, thank you so much for joining us. Another great episode. Please click like, subscribe, follow, leave a review. Those things make me and Andrew feel awesome. Thank you guys and have a great day.